the typical business of but we are still very much connected and supported by Ibm. So today, my topic is really about acceleration. How do you accelerate the democratization of healthcare through AI? What a difficult word. Really, what is it about? It is about how do you do your digital transformation, right? So globally, that a lot of talks around digital transformation, and it's in every single industry. And even in healthcare today, we talk a lot about digital transformation in healthcare. So what does it really mean? What is digital transformation? What is so-called democratization of healthcare? So alright. So there are a lot of healthcare challenges in the market today. Or even within Southeast Asia, we are seeing a lot of similar uphill challenges in terms of healthcare challenges. So what do we mean by vulnerable population? Have you heard of this thing called silver tsunami? So silver tsunami basically it is that what we are looking at is countries like Australia, countries like Singapore, countries like Japan, where in a very soon distant, we're gonna have more people who are actually above the age of 60 versus the age versus the amount of people below the age of 60s. So I believe in the year 2050, we're gonna have about 2 billion people who are actually above the age 60, and that will probably include many of us in the audience. I'm definitely gonna be above 60 when 20 is. So I think the vulnerable population is growing exponentially, and as well as what we are actually seeing is the increase of chronic diseases. In fact, a lot of people have multiple chronic diseases. So if you look at cancer on its own, it's actually becoming one of the leading causes of death in the world. And in fact, in Thailand, the cancer incidence is expected to grow by 19% in the year 2025, and that is 6 years from now. So we're seeing huge growth in this sort of area. The increase in demand for healthcare is putting a lot of pressure onto both public and private healthcare system. So there is a huge shortage in trained clinicians, and what we're actually also seeing is that in the US, for example, physician on average about 20 patients, but in the UK, we're actually seeing that GP are seeing about 40 patients a day. What it really means is that it's putting a lot of pressure onto the healthcare system. So doctors, clinicians are putting in extra hours to try to be able to meet this demand. And one interesting thing is that you realize that time spent are decreasing. In the US, on average, a doctor spends about 21 minutes with patient. In the neighboring Singapore, doctor spends about 9 minutes per patient. And guess how many minutes in Bangladesh a doctor spends with a patient? 43 seconds. So literally, the patient will come in, sit down, pretty much your 1 minute is up, right? So it's a lot of pressure on the health system. And lastly, it's really about the cost and complexity in managing these cases, right? So it's costing pharmaceutical company more money to take a drug to the market, as well as it is so expensive to handle chronic cases, patients with multiple chronic cases. So what we are actually looking at is that both public sector, which pretty much in this region, especially in Southeast Asia, we're primarily public sector dominant. So it's putting a lot of pressure on our public sector as well as private health insurance, right? So, and top it up, we're gonna have things like hospital-acquired infection, readmission rates, things like adverse events. So all these are putting significant pressure onto our healthcare system. Besides healthcare challenges, let's go to the next slide. We have this thing called data tsunami. With advancement of technologies, with the adoption of EMR system, what we are actually seeing is that there comes a challenge, right? Overwhelming amount of data. So healthcare data is expected to double every 73 days in 2020. And physicians simply could not keep up with researching about the patient's medical conditions while treating patients. It's becoming so complicated in medicine as well. And one of the challenges is that studies indicate only about 20% of knowledge used today in treating patients are actually evidence-based. So we have been talking about evidence-based medicine for a good many years. But are we really adopting it? Are we really treating patients using evidence? Right? And how does physician keep up with the amount of information that we get? Right? So if you look at it, clinicians at the bottom right hand side, clinicians are spending 64% of their time on non-interpretive tasks. So we are spending more than half of our time looking at things like searching for information, digging through the EHR, digging through the medical records. That is, what it really means is that we are spending even less time with patients. And in a very patient-centric world today, we are looking to see how we can actually turn this around and spend more time with our patient. And studies also indicate that only about 1% of the data generated today is being analyzed. 1%. That is really the tip of the iceberg. Because what we are doing here is that the amount of data that has been generated simply outpaces our ability to actually do anything with it. So we also talk about things like social determinants, where we live, what we eat, do we exercise. So important part of a patient here. We are growingly how many watch? Starting to record this information from our Apple Watch, from our Fitbit, from our tracker. But how do we actually use it? How do we analyze it so that we can actually provide more personalized care to our patient, right? So these are some of the areas that I think growingly is where we actually need to think about. And so more and more we have our clients coming to us and really starting to talk about, hey, what can AI do? So IBM has got our Watson. So Watson is our artificial intelligence. So more and more clients coming to us and say, hey, what can your AI do? Right? So is it possible for your AI to kind of come in, analyze the data, provide us a good insight into it? Or can we address some of these healthcare challenges that we talked about earlier? Well, I don't have a definitive answer, but I think yes, to a certain extent, definitely AI can address many of these healthcare challenges, the data tsunami that we are having. So there are plenty of words or pictorial terminology out there that really allude to the concept of AI. So it's kind of everything that is surrounding the artificial intelligence brain here. These are all a lot of big words that we hear out in the market that really allude to the term of AI. But what really is an AI? Right? So AI is actually a concept where machine will be able to carry out tasks that we deem as smart. So what human think that is smart task, this is what AI would do. And machine learning is basically an application of AI where we give access to the machine to access the data, and then you learn from it. So I'm pretty sure the next question will come is that, does that mean that AI would replace human? Right? So would AI really replace human? That would be a lot of question. That would be a lot of question in a lot of people's mind. Okay, well, I was supposed to have animation around it, but it seems like it didn't work. So, what does human typically excels in, right? So, we have that inherent capability of like being able to learn, discover, and make decisions. When we are faced with a dilemma, what we can actually do is that we can actually apply our morals, our common sense, and reason. We can dream up new ideas, and we can also do generalization with even with like essential clues or pieces of information that are missing, right? But however, what we are restricted by is the time it takes for us to learn. Time it takes for us to learn about new information, time for us to absorb that information, and more importantly, we have an inherent bias in us. So that biasness or that unconscious biasness will actually affect how the way we make decisions. However, on the other hand, what can AI really do? Right? AI like Watson, what they have the ability to do is that they will be able to understand data, whether it is structured, unstructured, text form, sensory, in the context and meaning, in a huge volume and speed at a time. For example, one of our clients, so over here it says, one of our clients asked Watson to ingest about 80 million documents at the start. And it adds about 30,000 additional documents every single day. So this is the amount of speed AI can do. It has the ability to ingest all this information, understand this information. Can human do that? Potentially, I guess, but going through 30,000 documents a day will be very, very hard. So, AI can also reason, so they will be able to build like things like hypotheses, they will be able to consider argument and as well as come up with possible recommendations to help us make better decisions. And more importantly, it has the ability to learn non-stop, ongoing. We are limited by how tired we are that day. If we are tired, we're gonna stop learning, right? But AI has the capability, the endless capacity to continuously learn. So essentially, what we are saying is that if you bring human and AI together, it is not about AI replacing human, but it is about augmented intelligence. So what is augmented intelligence? Basically, it empowers human to make much more insightful, much better decisions because it provides actionable insights. Through AI, through its ability to learn a lot of documents, a lot of information in a short amount of time. So this is where we think that AI and human can come together, and which is why these days you hear a lot about AI not referring to artificial intelligence, but actually referring to augmented intelligence. So, having said that, what I'm going to do is that I'm going to share a case. It's actually a product that's already in the market. This is actually IBM Watson Health and Medtronic take to bring diabetes management to the complete new level. So what we actually did was that we used Watson AI using the cognitive capabilities as well as our analytics capabilities and bring it to the data from Medtronic insulin pump and glucose monitors. So what can this sugar IQ thing do, or what did Watson do in this case? It was able to actually predict hypoglycemia. So if you don't know what is hypoglycemia, basically it's extreme low blood sugar. And we are able to predict it 3 hours before the onset. So for someone who lives with diabetes, this is something that is incredibly important because this could lead, if you have hypoglycemia, chances are it might lead to very, very dangerous health events. So the next thing I'm going to show you is that I'm going to share a video of Michelle Shaw. She's someone who lives with diabetes, and I had the pleasure of meeting her in January this year.
You track my numbers. You make me, my family, my kids worry. The uncertainty of whether I am making the right decisions about you and my health never leaves. You're unpredictable and leave me guessing. But now, my phone, which I use to know the weather before it hits, get directions, and keep in touch with friends and family, has a new app designed to help people with diabetes like me. With the Sugar IQ Assistant, now I not only have numbers and data on you, but insights into what makes you tick. The Sugar IQ Assistant understands me, my life as a wife and mom with young kids, my passion for exercise, and my commitment to a job I love. And Sugar IQ with Watson technology actually predicts when I could have lows, so I can get ahead of it. With the Sugar IQ Assistant, I am now clearly smarter about you, diabetes. Yours truly, Michelle.
So this is one of the ways where, combining cognitive analytics, combining past cases, this is where AI learn and be able to actually bring huge benefits to people's life and make changes to people's life. So if we move to the next slide, what is the AI's role in transforming healthcare? So we believe that there are 3 key roles that AI could do in really, really transforming healthcare. The first thing is assisting clinicians. So by augmenting clinical expertise, it has the potential to bring high quality, consistent quality care to patients. So it has the ability to help clinicians to make much more accurate diagnosis, create higher quality treatment plans, as well as identify new care pathways. So it has the ability to provide much more insightful information and decisions through millions of data that is actually available that otherwise would be very limiting if you are just human doing it. The second thing that we think AI could do is really making healthcare accessible to patients. In a country, for example, like Thailand, not every single city is like Bangkok. We have regional cities which are smaller, which are not so accessible. I personally have been to Mae Hong Son province, which is a national park. There are people who live there that has no access to good quality care. And in fact, some of the kids who come to the school that we went walk about 20 kilometers on a weekend just to go to the school. So you can see that AI has the capability to transform and bring healthcare to every single patient, regardless of where you live. And that is very, very important. And when we talk about democratization of healthcare, I think this is really an important part, which is to bring it to every single person. And lastly, we believe that it has the ability to accelerate. it has the ability to scale, and that's very, very important too. Whenever you have any sort of project, how can you scale this project such that you can bring it to the people in a speed and in the speed of implementation that you want to. Which is why healthcare AI not only aim to bring healthcare to the people today, but it's also in the future. How do we make it more accessible? More people can have access to the same thing, right? Because we are very, very privileged that we live in a city, but not everyone is like us. So how do we bring it to more people that matters and that is important in the city, in the country? So in Watson Health, can you go back to another slide? So Watson Health, if you go back a little bit, Watson Health is a business that is purely focused on healthcare. This is our pure focus in our organization. But being linked to IBM, which is one of the leading provider of AI, we are very, very well positioned to help to actually address all these AI roles in healthcare transformation. More importantly, we have built a good combination of data analytics, expertise, and services that will actually, hopefully, bring improvement to the quality of care to the patient by clinicians when they need it and where they need it as well. If you go to the next slide, please. These are the 6 areas of focus that Watson Health is focused on. Oncology and genomics. Earlier we talked about 70% of, let me go back to that data. 70% of cancer death occurs in developing countries. And this is one of the most important part for a lot of countries. Just like I mentioned earlier, cancer incidences are bound to grow about 19% in Thailand alone in 2025. That's a huge growth number. So how do we address that? In government, in life sciences, in value-based care, imaging, and payer. These are the areas that we believe is a full healthcare ecosystem that needs to be addressed as a healthcare ecosystem as a whole. So let me start by talking a little bit about our oncology suites. So we built an oncology suite that is completely powered by AI. So we have Watson for Oncology. So Watson for Oncology is actually an evidence-based clinical decision support. So it provides evidence-based treatment based on individual patient profiles. And if you look at genomics, it's basically an interpretation of genetics mutation so that we would actually be able to provide very personalized recommendation on how to treat a patient with cancer. And last but not least, is clinical trial matching. Earlier we talked about how expensive it is for pharmaceutical company to bring drugs to market. I believe the number just now was 2 billion. 2B. So, and if you look into the clinical trial world, it's very, very hard to match patient to whatever drugs that is actually on clinical trial. And very often it's delayed due to such instances. So what we are trying to do here is that how do we automate the trial identification as well as the management? How do you qualify the patient through the use of AI? Because AI can go through your patient profile in a matter of seconds, in a matter of minutes, versus eyeballing every single line in your electronic medical record. That's going to be really, really hard. So AI has the capability to do that. Go to the next slide, please. So Watson for Oncology is making an impact in the world. So Watson for Oncology, like I mentioned earlier, is an evidence-based clinical decision support that provides recommended treatment for patients based on the individual patient profile. So what we do is that we actually have a training partner, which is Memorial Sloan Kettering in New York. So MSK and its oncologists are the one who train Watson, and we provide Watson MSK related evidence and literature as well. Currently, it's actually addressing about 13 different cancer types, and that represent about 80% of the oncology incidences and prevalence in the world. It is roundabout in 25 different countries, 300 hospitals, and we're very glad to report that it has touched about 140,000 patients and is growing by the number every day. But what we really aim to do is not just about treating patients with cancer, but it's about bringing this best-in-class cancer treatment plan and cancer treatment recommendations to patients regardless of where they are. So I'm going to share another video today. So this video is by a lady called Madam Bharati. So Madam Bharati went to Manipal Hospital in India. So this is her story on using on her experience with Watson for oncology and how oncologists in Manipal was able to demonstrate what the treatment plan would be good, or what the recommended treatment plan would be suitable for Madam Bharati as well.
Initially, I thought that it would be just a simple fibroid, but it happened to be cancer.
We were all very, very worried about her because she's the strength of our family.
I am a science graduate, a full-time housewife, always interested in art.
So today morning I saw a 70-year-old lady who was operated for breast cancer almost a month back. She was a couple of weeks. She was what Watson also said, that yes, there has been so much participate in what to choose.
We were quite fascinated by artificial intelligence to compete in healthcare. Our experience has been quite amazing.
Dr. Joseph have to build this technology also so that it gives us a better.
That Watson suggested and what was to her, it gave her some confidence that yes, what was being suggested is something that has been used in other parts of the world as well, especially in the US.
There are a lot of people who cannot afford a treatment, let alone a second opinion, using artificial intelligence technology. So the fact that we are able to do this better is something that I'm very
I'm happy that technology advanced and it's helping patients. It's a service towards humanity.
All right. So this is just an example of how we can actually bring consistent care plans to patients. Doesn't matter where you are, whether you're in India, whether you're in the US. So shifting gear a little bit, when you talk about digital, very often you can't get away from value. A lot of healthcare providers, a lot of government are shifting gear towards value-based care. So what exactly is value-based care? Value-based care is actually a healthcare delivery model where healthcare providers like hospitals are being rewarded based on patient health outcomes. So currently what we do a lot is called fee for service, which basically means you come in for a surgery, I'll pay you for the surgery. However, in a value-based care environment, we're measuring based on the outcome of that particular surgery rather than the surgery. So in value-based care, what we have actually also done is that within Ibm Watson Health, we have created a huge ecosystem, partnerships to unlock non-traditional data, things like social, physiological, economics. So these are important non-traditional data sets that we believe to be able to determinants and as well as to provide good implication. So that we think is particularly important. Being transparent to your disparate health data. So aggregating, normalizing, and as well as finding meaning within the data. So we talk about physicians spending a huge amount of time on non-interpretive tasks. Is there a way for us to be able to minimize that time spent on non-interpretive tasks? Are we able to derive insights from your data so that we can bring it straight to the clinician so that they are not spending time digging through this information? Second part is like manage performance by understanding and measuring your population. So 67% of patients who are actually catastrophic this year, they are not last year. So these are all these populations that are hidden underneath the iceberg. How do we understand our population? How do we dig out this information so that we can actually help them, we can actually address them, we can actually attend to them before they turn catastrophic? How do you deliver personalized care? This is also very, very important. Growing which patient and doctors ratio. The amount of doctors that we have versus the amount. This is also very. How do you transform? How do you transform in a long-term plan? So how do you manage the health of your entire population? How do you encourage them to come early for the medical checkup, for example? Or if they are non-compliant, they have care gaps in these patients. A patient with hypertension that has not come for a medical appointment for the past 6 months. How am I able to identify this population? How am I able to engage them, ask them to come to see the doctor before the situation turns for the worst, right? So if you talk about personalized care, this is an interesting use case that we have, which is the Albert A. Children's Hospital. So they have an aim to become a true cognitive hospital. So this is what they wanted to do, right? So what they did was that they developed an application for children. It's a children's hospital, so they developed an application for children. These children are able to create an avatar, and they can actually talk to the avatar. So they will be able to ask questions to the avatar, questions that they might not otherwise ask the doctor, or they're too shy to ask the doctor. So questions like, when would I be able to play football next after my surgery? Or when would I be able to see my mom? So the aim is really to minimize surprises for children, to enhance that experience for children when they are actually inside the hospital. So this is again another way to actually personalize this care, and this is actually to a very, very special group, very, very special vulnerable group, which is pediatrics. So this is again a slightly different look into how the way you can actually transform and how the way you can actually personalize care for your patient. And importantly, government plays an important role in our entire healthcare ecosystem, right? In Southeast Asia, in fact, I think we are nearly 100% public sector health, which is public sector health dominant. So we have primarily public health being provided to citizens. So government play an important role in this entire healthcare democratization or healthcare digitalization. In fact, like Thailand, you have Digital Thailand 4.0, right? So this is again some of the initiatives that government are already embarking. So one of the important things is, for example, how do I improve my program delivery and benefits? How do I ensure that my citizen, my population, understand what are the policy, what are the initiatives out there, and they could actually access it. For example, in Singapore, we are working with we are working with Ministry of Social and Family Development on how do you make sure that family who are divorced, How do you ensure that their children will be able to have access to counseling services? How do you make sure that they are aware of it? This is important part that we are actually working with a lot of government and agency to help to bring this forward. We talk about value-based care, and in value-based care you cannot get away from program integrity. So program integrity, we look at fraud, waste, and abuse. How do you minimize the abuse? How do you make sure that your $1 that is spent in your healthcare to the people is worth $1, if not more? So you want to make sure that your value is there. And lastly is that how do you effectively adapt and lead to policy changes? How do you identify what are your cost drivers? These are very, very important because healthcare costs are increasing exponentially. So how do you identify what is driving up your cost and then change your policy, adapt your policy so that you would actually be able to make sure that you deliver the most value to your citizen. Because what the government, every single initiative that comes from the government is spending public's money. You want to make sure that you're responsible for the money that you spent. So this is one of my last slides, and this is something interesting that we do in Australia. In IBM, we continue to innovate, we continue to research, we continue to try to find new ways on using AI to advance challenges in healthcare. We do this research in partnership with University of Australia, and what we are actually doing is that we're trying to identify how we will be able to identify melanoma quicker and more effectively. Melanoma is one of the silent killer in Australia. Interesting fact, one person dies of melanoma every 6 hours in Australia. That's every 6 hours. That's a lot of people who die of melanoma. So we can actually share a video on the project that we actually do.
This is Australia's silent killer. One Australian dies every 6 hours from melanoma. Tragically, clinicians can only diagnose it at about 60% accuracy with the naked eye. They needed help. But when melanoma is hard to detect, how do you fight it? You don't. You outthink it.
Hello, my name is Watson.
Meet Ibm Watson, dubbed the smartest machine on Earth. Watson understands, reasons and learns just like humans, only on a massive scale and at high speed. But Watson needed data. We invented the Watson Smart Mirror, a simple, augmented reality skin check. Every face was examined by our machine learning algorithms and built-in UV camera to determine their sunburn risk in today's weather conditions. Those considered high risk were immediately referred to an on-site skin specialist who took high-resolution photographs of each suspicious mole. These images are helping train Watson to detect variations in colour, border, symmetry, network, similarity and score. For those who couldn't meet Watson in person, a social media campaign drove Australians nationwide to share their melanoma stories. Local celebrities kick-started conversation.
From the top of my nose down to the base of my chin.
Every tweet, post and photo helped our understanding of melanoma. With all this new data, Watson is now helping researchers work to boost detection accuracy from 60% with the naked eye to 91%.
If I hadn't met Watson at Bondi, they may never have found the suspicious mole and would probably still be carrying it around.
I hope to help more Australians like you. So together, we can finally outthink melanoma. Catch you later, mate.
So with that, I would like to end the session with one of our Watson Health mission. Our mission is really to improve life by giving hope by delivering innovation to address the world's most pressing health the use of data and cognitive technologies. So with that, I thank you very much for your attention. Thank you.
Thank you very much, Mr. Kim. Going to the next topic, APEC Medical Device Outlook 2019. Thank you very much. Next topic, APEC Medical Device Outlook 2019.